Magandang araw po sa ating lahat. Nagbabalik po tayo sa ating rationalization, and what we're going to tackle this time is all about common questions in psychiatric nursing. We have 50 items here and simulan na natin agad. Number 1. The nurse is caring for a patient who is believed has been abusing opiates. Assessment findings in a client abusing opiates such as morphine sulfate include A. Dilated pupils and slurred speech, letter B. Rapid speech and agitation, letter C. Dilated pupils and agitation, and letter D. Euphoria and constricted pupils. Ang sagot po natin dito is letter D. Euphoria or feeling high and constricted pupils. Constricted pupils po yan ha, hindi po siya dilated. Okay, tandaan lang natin, opiates, meron siyang O. So, constricted. Con. 'Di ba? Meron ding O yung constricted. Okay? So, yan po para hindi natin mapagpalit. Assessment findings in patient abusing opiates include agitation, slurred speech, euphoria, and constricted pupils. Again, ang sagot po natin dito for the assessment finding in a client abusing opiates such as morphine is letter D, euphoria and constricted pupils. Opiates for constricted pupils. Okay? Next question is number 2. Which of the following is not a characteristic behavior of a child with attention deficit hyperactive disorder or ADHD? A. High degree of organization in accomplishing tasks. B. Blurting out answers before questions have been asked. Letter C. Difficulty engaging in leisure type activities. And letter D. Failure to follow through with instructions. Okay, so sa ADHD meron tayong tatlong characteristics. And I want you to memorize this. Tandaan po natin yung EHI mnemonic. EHI for inattentiveness, hyperactivity, and impulsivity. Again, EHI mnemonic, inattentiveness, hyperactivity, and impulsivity. Ang hinahanap natin dito is not characteristics of a child with ADHD. So, obviously, our answer here is letter A. High degree of organization in accomplishing tasks. Kabaliktaran po ng signs and symptoms ng ADHD. Okay, so yan po ang ating sagot. Yung letter B, blurting out before questions have been asked. This is an impulsive behavior, so pasok siya under ADHD. Yung letter C naman, difficulty engaging in leisure type activities, pwede din to under ADHD kasi nga wala silang focus and inattentive din sila. Pero this is also depends on the activity. Kasi some children with ADHD might engage intensely in activities they find interesting. And yung letter D, failure to follow through with instructions is an inattention characteristics din. So, pasok siya under ADHD. So again, our answer here is letter A. Huwag natin kalilimutan yung EHI mnemonics natin. Inattentiveness, hyperactivity, and impulsivity. Okay? Number 3. A patient's feelings of despair and depression have lifted, and she tells the nurse, I feel better now. The nurse understands that this patient is A. No longer a suicide risk. B. Less of a suicide risk than when she was deeply depressed. Letter C. More of a suicide risk than when she was deeply depressed. And letter D. A suicide risk only in the evening. Ang sagot po natin dito is letter C. More of a suicide risk than when she was deeply depressed. Dito, the patient is at highest risk of suicide when her depression is resolving or the client is returning to normalcy. This is the time na magkakaroon na siya ng lakas para ma-implement ang kanyang mga plans. Okay? Again, our answer here is letter C. Very common question po, wag nating kalilimutan. Number 4. Which of the following drugs is prescribed to improve cognitive functioning in an older patient with Alzheimer's type dementia? Again, which of the following drugs is prescribed to improve cognitive functioning in an older patient with Alzheimer's type dementia? Ang sagot po natin dito is letter A. Danepezil or Aricept. Aricept is an anticholinesterase agent used to improve cognitive functioning in patients with Alzheimer's disease. The drug prescribed to improve cognitive functioning in an older patient with Alzheimer's type dementia is Danepezil, Aricept. Okay? Haldol and risperidone may be also used to calm the patient's agitation. Xanax may be also used to treat the patient's anxiety. Okay? So, ang sagot po natin dito for Alzheimer's type dementia is letter A, Danepezil, Aricept. Number 5. What is the nurse's most important role in caring for a patient with mental health disorder? A. To offer advice. B. To know how to solve the client's problems. And letter C. To establish trust and rapport. And letter D. To set limits with the client. Our answer here is letter C. To establish therapeutic nurse-client relationship, it is primarily important to establish trust and rapport. Huwag po natin kalilimutan. Number 6. The patient diagnosed of chronic schizophrenia has been taking neuroleptics for many years. Assessment reveals unusual movements of the tongue, neck, and arms. Which condition would the nurse suspect? A. Tardive dyskinesia. B. Dystonia. C. Neuroleptic malignant syndrome. And letter D. Akathisia. Ano daw? The assessment reveals unusual movements of the tongue, neck, and arms. Which condition would the nurse suspect? Anong sagot natin dito? Our answer here is letter A. Tardive dyskinesia. Unusual movements of the tongue, neck, and arms suggest tardive dyskinesia. Huwag nating kalilimutan. Sa dystonia, it is characterized by cramps and rigidity of the tongue, face, neck, and back muscles. Sa neuroleptic malignant syndrome naman, it causes rigidity, fever, hypertension, and diaphoresis. Akathisia causes restlessness, anxiety, and jitteriness. Basta huwag nating kalilimutan, unusual movements of the tongue, neck, and arms suggest tardive dyskinesia. Okay? Number 7. Opiate withdrawal causes severe physical discomfort and can be life-threatening. To minimize these effects, opiate users are commonly detoxified with. Our answer here is letter C, methadone. Methadone is used to detoxify opiate users because it binds with opioid receptors at many sites in the central nervous system but doesn't have the same deleterious effects as other opiates such as cocaine, heroin, and morphine. Okay? Our answer here is methadone. Number 8. A patient in an acute care mental health program refuses his morning dose of an oral antipsychotic medication and believes he is being poisoned. The nurse should respond by taking which of the following actions? A. Administering the medication by injection. B. Omitting the dose and trying the next day. Letter C. Crushing the medication and putting it in his food. And letter D. Consulting with the physician about a plan of care. Ang sagot po natin dito is letter D. Consulting with the physician about a plan of care. To determine a plan of care for clients who are non-compliant with medications, the nurse should consult with the physician. Yung letter A, administering the medication by injection, mali po kasi forcing medication violates patient autonomy. Hindi po natin ipipilit. Yung letter B naman, omitting medication may exacerbate symptoms, kaya X po ang letter B. And also yung letter C, mali din po kasi crushing or hidden medications like putting in his food compromises trust and ethics. Okay, so ang sagot natin dito is letter D, consulting with the physician about the plan of care. Dito kasi, you respect the patient's autonomy habang ina-address mo yung concern, and also it ensures medication administration aligns with patient's best interest. Okay? Basta ang sagot po natin dito is letter D. Number 9. A patient with borderline personality disorder is admitted to the psychiatric unit. Initial nursing assessment reveals that the client's wrists are scratched from a recent suicide attempt. Based on this finding, the nurse should formulate a nursing diagnosis of. Obviously, our answer here is letter C. Risk for violence, self-directed related to impulsive, mutilating acts. Okay? Ang sagot natin dito is letter C. The predominant behavioral characteristic of the client with borderline personality disorder is impulsiveness, especially of a physically self-destructive sort. Okay? Basta ang sagot natin dito is risk for violence, self-directed related to impulsive, mutilating acts. Okay? Number 10. A patient tells the nurse that people from Mars are going to invade the Earth. Which response by the nurse would be most therapeutic? A. That must be frightening to you. Can you tell me how you feel about it? B. There are no people living on Mars. Letter C. What do you mean when you say they're going to invade the Earth? Letter D. I know you believe the Earth is going to be involved, but I don't believe that. So, ang sagot natin dito is letter A. That must be frightening to you. Can you tell me how you feel about it? This response addresses the client's underlying fears without feeding the delusion. Sabi ng nurse, that must be frightening to you. Sa sinabi niyang yan, ina-acknowledge na yung concern ng patient and validates her emotion. While she also encourages expression of feelings sa follow-up na tanong niya, can you tell me how you feel about it? O, diba? Very therapeutic. It fosters trust and empathy. Refuting client's delusion would increase anxiety and reinforce the delusion. Kaya mali po ang letter B. Asking the client to elaborate on the delusion would reinforce it. Mas lalo mo pang pinag-iisip yung patient, so mali din po ang ating letter C. Sa letter D naman, sabi niya, I know you believe the Earth is going to be involved, but I don't believe that. Mali po kasi voicing this belief about the delusion would not help the client deal with underlying fears. Okay? So, wag po nating kontrahin agad. So, ang sagot po natin dito is letter A. Okay? That must be frightening to you. Can you tell me how you feel about it? Okay. Very therapeutic. Number 11. After learning that a roommate is HIV positive, a patient asked the nurse about moving to another room on the psychiatric unit because the client doesn't feel safe now. What should the nurse do first? A. Move the patient to another room. B. Ask the patient to describe any fears. Letter C. Move the patient's room to a private room. And letter D. Explain that such a move wouldn't be therapeutic for the patient or roommate. Our answer here is letter B. Ask the patient to describe any fears. To intervene effectively, the nurse must first understand the patient's fears. After exploring the client's fears, the nurse may move the client or roommate or explain why such a move wouldn't be therapeutic as needed. Okay? Basta, ang sagot natin dito is letter B. Ask the patient to describe any fears. Tanungin muna. Okay? Number 12. The nurse is using drawing, puppetry, and other forms of play therapy while treating a terminally ill school-age child. The purpose of these techniques is to help the child A. Internalize his feeling about death and dying. Letter B. Accept responsibility for his situation. Letter C. Express feelings that he can't articulate. And letter D. Have a good time while he's in the hospital. Ang sagot po natin dito is letter C. Children may not have the verbal and cognitive skills to express what they feel and may benefit from alternative modes of expression. It is important for the child to find a way to express internalized feelings. Okay? So the child must also know that he is not to be blamed for this situation. In the process of doing play therapy, the child can also have fun. But that isn't the main goal of the therapy, okay? Again, the purpose of these techniques, like using drawing, puppetry, and other forms of therapy while treating a terminally ill school-aged child, is to express feelings that he cannot articulate. Alright, so next question, number 13. A 26-year-old male report losing his sight in both eyes. He's diagnosed as having a conversion disorder and is admitted to psychiatric unit. Which nursing intervention would be most appropriate for the client? A. Not focusing on his blindness. B. Providing self-care for him. And letter C. Telling him his blindness isn't real. And letter D. Teaching eye exercises to strengthen his eyes. Ang sagot po natin dito is letter A. Not focusing on his blindness. Focusing on his blindness can positively reinforce the blindness and further promote the use of maladaptive behaviors to obtain secondary gains. The client should be encouraged to participate in his own self-care as much as possible to avoid fostering dependency. Blindness and other physical symptoms in conversion disorders aren't under the client's control and are real to him. Okay? Eye exercises won't resolve the client's blindness because no organic pathology is causing the symptoms. So, mali po ang ating letter D. This question is from the Book of Udan, a former board of nursing. An exact question po. Number 14. A patient age 87 with major depression undergoes 6 electroconvulsive therapy treatment. When assessing the client immediately after electroconvulsive therapy, the nurse expects to find... Ang tamang sagot po dito is letter B, transitory short and long-term memory loss and confusion. Huwag nating kalilimutan, ECT commonly causes short and long-term memory loss and confusion, especially in geriatric clients, lalo-lalo na sa mga matatanda. Bihira lang po yung permanent short and long-term memory loss, okay? ECT is more likely to lead to hypotension than hypertension and rarely causes hypomania. Next question, number 15. Victims of domestic violence should be assessed for what important information? Again, victims of domestic violence should be assessed for what important information? A. Reasons why they stay in the abusive relationship. For example, lack of financial autonomy and isolation. Letter B. Readiness to leave perpetrator and knowledge of resources. Letter C. Use of drugs or alcohol. And letter D. History of previous victimization. Ang sagot po natin dito is letter B, readiness to leave perpetrator and knowledge of resources. Victims of domestic violence must be assessed for their readiness to leave the perpetrator and their knowledge of the resources available to them. The nurses can then provide the victims with information and options to enable them to leave when they are ready. The reasons why they stay in the relationship are complex and can be explored at a later time. Okay, the use of drugs or alcohol is irrelevant. There is no evidence to suggest that previous victimization results in a person seeking or causing abusive relationships. So, mali po ang ating letter D. Number 16. During a group therapy session in the psychiatric unit, a client constantly interrupts interrupts with impulsive behavior and exaggerated stories that cast her as a hero or princess. She also manipulates the group with attention-seeking behaviors such as sexual comments and angry outbursts. The nurse realizes that these behavior are typical of histrionic personality disorder. Ang ating sagot po dito is letter C. The patient's behavior are typical of histrionic personality disorder, which is markedly be excessive emotionally and attention-seeking. Okay? The patient constantly seeks and demands attention, approval, or praise, may be seductive in behavior, appearance, or conversation, and is uncomfortable. Except when she is in the center of attention. Gusto niya na siya yung center of attention. Typically, a patient with paranoid personality disorder is suspicious, cold, hostile, and argumentative. Avoidant personality disorder naman is characterized by impulsive, unpredictable behavior and unstable, intense interpersonal relationships. Okay? Number 17. Okay. So, ang sagot natin dito is letter C, histrionic personality disorder. Number 17. When teaching a patient receiving lithium, the nurse should instruct the patient to A. Drink at least 6 to 8 glasses of water per day and to avoid caffeine. Letter B. Limit the use of salt in his diet. And letter C. Discontinue medicine when feeling better. And letter D. Increase the amount of sodium in his diet. Our answer here is letter A. Drink at least 6 to 8 glasses of water per day and avoid caffeine. Caffeine should be avoided because it increases urine output. Patients needs to maintain adequate fluid intake to avoid lithium toxicity. Again, patients needs to maintain adequate fluid intake to avoid lithium toxicity. Huwag po nating ililimit or dagdagan yung salt intake because the kidneys will hold on to lithium or excrete it if salt intake varies. Patients should remain on medication even though they are feeling better. Tuloy-tuloy lang po. So, ang ating sagot dito is letter A. Drink at least 6 to 8 glasses of water per day and to avoid caffeine when you are receiving lithium. Okay? Number 18. A schizophrenic patient with delusion tells the nurse, "There's a man wearing a red coat who's out to get me." The patient exhibits increasing anxiety when focusing on the delusions. Which of the following would be the best response? A. This subject seems to be troubling you. Let's walk to the activity room. Letter B. Describe the man who's out to get you. What does he look like? Letter C. There's no reason to be afraid of that man. This hospital is very secure. Letter D. There is no need to be concerned with a man who isn't even real. Ang sagot po natin dito is letter A. This subject seems to be troubling you. Let's walk to the activity room. This remarks distracts the client from delusion by engaging the client in less threatening or more comforting activity at the first sign of anxiety. In this option, the patient acknowledges patient's distress and redirects focus away from delusions. The nurse should reinforce reality and discourage the false belief. The other options focus on the content of the delusion rather than the meaning, feeling, or intent that it provokes. Basta ang sagot po natin dito is letter A. This subject seems to be troubling you. Let's walk to the activity room. Okay? Number 19. The nurse is developing a plan of care for a patient with anorexia nervosa. Which action should the nurse include in the plan? Obviously, ang sagot po natin dito is letter C. Set up a strict eating plan providing initially a one-on-one supervision during meals and for 1 hour afterward. Establishing a consistent eating plan and monitoring the patient's weight are important for this disorder. The family should be included in the patient's care. The patient should be monitored during meals, not given privacy. Hindi po siya binibigyan ng privacy. Exercise must be limited and supervised. Okay, ang sagot po natin dito is letter C. For anorexia nervosa, set up a strict eating plan providing initially a one-on-one supervision during meals and for 1 hour afterward. Okay? Number 20. A patient with paranoid schizophrenia runs to the nurse and says, "Why are you poisoning me? I know you work for central thought control. You can keep my thought. Give me back my soul." How should the nurse respond during the early stage of the therapeutic process? A. I'm a nurse. I'm not poisoning you. It's against the nursing code of ethics. Grabe. Letter B. I'm a nurse and you're a client in the hospital. I'm not going to harm you. Letter C. I'm not poisoning you. And how could I possibly steal your soul? Letter D. I sense anger. Are you feeling angry today? Ang sagot po natin dito is letter B. I am a nurse and you are a client in the hospital. I'm not going to harm you. The nurse should directly orient a delusional patient to reality, especially to place and person. Again, the nurse should directly orient a delusional patient to reality, especially to place and person. Okay? Denying and offering information about the delusion may encourage further delusion. So, our answer here is letter B. Number 21. A patient with obsessive-compulsive disorder and ritualistic behavior must brush the hair from his forehead 15 times before carrying out any activity. The nurse notices that the patient's hair is thinning and the skin on the forehead is irritated. A possible effect of this ritual. When planning the patient's care, the nurse should assign highest priority to A. Helping the patient to identify how ritualistic behavior interferes with daily activities. B. Exploring the purpose of the ritualistic behavior. Letter C. Setting consistent limits on the ritualistic behavior if it harms the patient or others. And letter D. Using problem solving to help the client manage anxiety effectively. Our answer here is letter C. Setting consistent limits on the ritualistic behavior if it harms the patient or others. Patient safety is the paramount concern and must be maintained. Therefore, setting consistent limits on potentially harmful ritualistic behavior takes highest priority. Okay, basta patient safety po. As the patient learns new ways to manage anxiety, the ritualistic behavior is likely to decrease. Number 22. When communicating with a child, which approach would be most effective? Select all that apply. A. Use simple language. Use simple language to ascertain the problem. Tama ba yan? Letter B. Ask questions indirectly to obtain specific information. Tama ba yan? Letter C. Talk about reality focusing on the present. Letter D. Avoid using body language to reinforce ideas. And letter E. Speak quietly but firmly when reinforcing behavioral limits. Ang sagot po natin dyan is letter A, letter C, and letter E. Sa letter A, use simple language to ascertain the problems. Tama po yan. And yung letter C, talk about reality focusing on the present. At saka yung letter E, speak quietly but firmly when reinforcing behavioral limits. When communicating with a child, the nurse should keep verbal communication brief, use simple language, talk about reality or focusing on here and now, and speak quietly but firmly when reinforcing behavioral limits. She should use direct questions to obtain specific information. Hindi dapat indirect. Mali po ang ating letter B. And body language helps to reinforce ideas about what has been said and encourages the child's expression of ideas and feelings. As well with letter D, mali po. Avoid using body language, sabi niya. Dapat gamitan daw ng body language to reinforce ideas. Okay? Number 23.